Hello, I'm Betty Casey, editor of Tulsa Kids Magazine, and we partnered with St. Francis Children's Hospital to bring you important health information for your family. You can find all of our interviews on our website, www.tulsakids.com, or in the magazine. Just look for PJ's Corner. Today, we're talking with Dr. Tammi Lahr about ADHD. Dr. Lahr is a pediatrician with St. Francis Children's Physicians. Welcome, Dr. Lahr.
Thank you.
Nice to have you here. So we'll start with a basic question. What are some of the most important signs you look for when diagnosing ADHD in children and adults?
Sure. So when we look at kids, we're looking for more than just busy kids. We're looking for impairment in the home environment or school, which in younger kids can look like climbing on a table and jumping off when they're supposed to be sitting in reading time, or older kids just forgetting to turn work in, getting distracted. It definitely varies, but there needs to be a level of impairment in multiple environments. So not just at school, but also at home. Definitely is where we look first.
Okay. And do you have a checklist? Do you go over these issues with parents, some of these symptoms, or how do you do
Sure.
that?
It depends on the family. One of the easiest ways is we use a Vanderbilt screener. It's a validated screener that's pretty quick and simple for teachers and parents both to fill out. There's two different forms. There is a teacher form and a parent form, and it asks very similar questions. And that is an easy thing to screen. There's also more detailed screeners. They can even see a psychologist and have a full panel of psychoeducational testing. That can be done through a school. If there's significant impairment, the school often will provide that. And if the parent just would like more information, or if there's a concern for learning disorders or overlapping mental health concerns, then we send to a PhD psychologist for that.
Okay, so it sounds like if a parent is noticing some issues with their child, start with the pediatrician possibly, and
Definitely.
then the pediatrician can help them go from there.
Yes.
How much of ADHD is genetic versus environmental, and what factors might make symptoms worse?
Sure. A lot of kids who end up with a diagnosis of ADHD, about 1 in 4 of those kids have a parent with ADHD. So there's a very good genetic component involved. Um, there are some environmental factors, prenatal exposure to nicotine or alcohol that raises risk. You can even have lead exposure in your environment, and that changes your neuro development as well and increase your risk for ADHD. If you've had recurrent concussions or just some disruptive home life as a younger child, that does raise your risk as well.
Okay. Um, what are some of the effective treatments for ADHD? And then how do you decide? I know sometimes children are on medication, sometimes they have therapy. How do you
Sure.
decide between medication and behavioral therapy?
A lot of it is in conjunction, doctor and families. We get to discuss that. Most of our studies show that younger kids, we definitely want to do some counseling. Our older kids benefit from that as well. But stimulant medicine has been shown to be the most effective. However, some families don't feel comfortable starting there. So we have that discussion, kind of decide their comfort level, and go from there.
Okay. So what strategies can help people with ADHD manage daily tasks like school or relationships if they're older?
Sure. I've actually got a little list here. There's 10 real simple things. So daily schedules, keeping the same thing every day in the same order becomes a routine. Routines are easier. Cutting down on distractions. So the second one is pretty difficult sometimes, but limiting things going on around you when you're expected to pay attention. And this one's hard for me, but organizing your house, making sure you put things where they live so you can find them again. And then a really important one for our kids is rewarding those positive behaviors. So looking for those positive things, just telling them what a good job they did, that reinforces them to do that again and again. And then please set small and attainable goals. Giving your child multiple steps makes it harder to follow through on. So charts, checklists for older kids, just giving them that thing to follow, 1, 2, 3, helps them follow through on all of those. And similar, keep those instructions brief. Limiting choices. So our younger kids, don't give them 10 options, give them 2. That way, whatever they choose, there will be an okay ending for the parent and the child. Um, and then calm discipline. So trying not to overreact when something doesn't go the way that you hope it will. And then on a parent side, reaching out to the teachers. So staying in communication with them really can help avoid some of those concerning behaviors.
Okay, yeah, the teacher can be your partner and helping you in providing that structure that your child might need, that little extra structure probably.
Definitely.
It sounds like these children, those are good parenting tips for all of us. It may just mean that these kids need a little bit more of that good parenting. And
A lot more structure helps.
yes, yes. Um, what are the biggest myths or misunderstandings about ADHD?
Oh, very many, but a lot of parents come in and they think they've got a lazy child or just they're not motivated. And this kid may really want to, but they just think they can't because it's hard, so they can't stay on task. Or they come in, they'll say they're just a daydreamer. They can't pay attention. My favorite description is they say, "Oh, squirrel," and they turn and they're easily distracted. Um, and then sometimes parents that we pick a medicine, they decide to try it, and then it will quote unquote cure the ADHD. So they think it might be like an antibiotic. They take it for a short period and then, it goes away. So that doesn't actually happen, sadly, for everybody. Um, and then another favorite is they have no problems staying on task and paying attention on their video games. So when it is a fun activity, it activates our brain differently. So kids with ADHD truly can focus when it's something really engaging and fun. And then when it's challenging, like schoolwork or a chore, that doesn't activate our brain the same. So parents just see it as they don't want to, whereas it's different for their brain. And I do feel bad for families. Sometimes they think it's poor discipline or they just didn't parent correctly. We know that's not accurate. Um,
Yeah, yeah, we don't want to blame parents for a disability or an illness or
Correct.
what. So, what resources might be available to those parents once they maybe have a diagnosis, or maybe they want some behavioral therapy or things like that? Do you direct them to resources, or do you have some resources?
Yes, definitely. Online, there are some very good resources. You can get some general information and more specific. The most simple place is to go to healthychildren.org. It's run by the American Academy of Pediatrics, and you can go to an ADHD checklist of options. It'll take you topic by topic. There's another website called understood.org. Those are both really good ADHD resources online. In the Tulsa area, we have therapists. I usually start with what insurance they have and kind of direct them from there. There are some insurances that prefer one therapist over another, so we'll kind of direct parents in that direction. And then there are schools that have embedded counselors, and so that's another good resource to look for.
Okay, thank you. That's great. Um, does ADHD, maybe this is another myth, but does ADHD typically change or get better as a person grows older? And what does that kind of long-term management look like?
Sure. One of the kind of easy ways I tell my families to look at it is When we hit puberty, our brain changes, so hormones kick in, and about a third, give or take, of kids actually improve. So they need less medicine, or they've learned enough techniques to manage their symptoms better, so they might be able to actually manage that without medication. About a third stay the same, so continue with the same treatment plan. And a third maybe need a little bit more assistance or more medication or interventions. So as we pass through puberty, we kind of work with families to see what their child needs more. And then there is a good portion, 80 to 85% of kids with ADHD are adults with ADHD. Now, whether or not they continue to need medication is definitely up to how they're functioning in a work environment or college.
Mm-hmm. Yeah, I guess it's just how we do in our daily lives and whether we're impaired in what we want to do in our daily lives.
Yes, that's correct.
Well, it sounds like starting with your pediatrician is the best place if we feel that we're having issues with our children that we have questions about, and asking a professional, and then you can go from there in working with the parent in terms of getting resources and help.
Yes. We're trained as pediatricians to help direct families. Oftentimes, we can provide diagnosis or treatments as needed and then refer from there.
Okay. Thank you. Well, thank you so much for the information today, and we appreciate you being with us, Dr. Lahr.
You're
Uh,
welcome.
you can find this interview and others like it at tulsakids.com and in print at PJ's Corner. And we're always grateful for the information from St. Francis. Thank you so much.
Thank you.